difficult urination is it's a really complex sort of set of symptoms that although one might think are really one thing, they actually could be about a half a dozen or a whole dozen different things that are happening at the same time. So what I'll do in this video, rather than go through a list of things, I'll just explain to you how urination works, and it'll give you an idea of the complexity of the whole thing that we take for granted every time we go pee. So in order for urination to happen, the bladder first has to store enough urine. A bladder is a low pressure, high volume capacity storage mechanism. It's made up of smooth muscle lined up with urothelium, and as urine is produced, it's being stored in the bladder. If the bladder capacity is too low because it's contracted, that's not, you're not going to have good urination cycles. It needs to be pliable, elastic, and as well as being able to contract when you want it to. So the bladder has to also generate enough pressure to get the urine out of it and to completely empty the bag. Right outside the bladder, if you're a man, there's a prostate. Now that prostate is important for sexual function, but it just happens to also be at the bladder neck, which is at the exit point of the bladder. Now you might think, why was the prostate placed right at the outside of the bladder, as if it was like a door to the urethra? It's almost like there's a bodyguard outside the bladder, and the urine can't come out unless it says hello to the prostate. Well, part of it, at least, is because the urethra, which is basically the inside of the penis, has a double function. The first function is to get the urine out, but the second function is also to get the semen out. So it's a double purpose organ. The other day in the office, I was doing a cystoscopy on a patient, and I showed him exactly where the ejaculation comes out in the urethra. It's called the verumontanum. And that place is basically, if you think about it as a sort of a urethra is there and the bladder is squishing. Now there's a sort of a duct, as if it's like an entrance into the highway from an exit. So you're trying to get on the highway, and all the cars are going to be going in. They're entering the urethra through the verumontanum, and that gets the ejaculation to come out. So the prostate secretions, as well as the secretions from the seminal vesicles and the sperm coming from the testicles, all they have to merge into the highway of the urethra. So that's why the prostate is right sitting around the urethra, is because you need that ejaculation to come into the urethra in order to exit from the penis. Because as you've noticed, the penis has two things that come out of it. Not just urine, but also ejaculation. So now the bladder, in order to get that urine through the prostate has to relax, and not just the prostate, but also the sphincter. So the sphincter is a muscle that sits right around the bladder neck, and most of the time is closed. And then when you want to urinate, it needs to open, and the prostate needs to relax, and the bladder has to squeeze. And when you're not urinating, the sphincter has to close, and the bladder has to relax. So you're actually doing quite the complex thing. During the day, when you're not urinating, you're relaxing your bladder, and not only are you relaxing your bladder, but you're progressively relaxing your bladder. It means as you make more urine, you're relaxing the bladder more and more. You didn't know this, but actually there's a reflex that when the bladder gets more and more full, there's a reflex that tells the spinal cord, hey, the bladder is stretching out. And that spinal cord tells the bladder, okay, now you can relax a little more to take in more urine that's coming down from the kidneys. So as the urine expands and fills up the bladder starts relaxing more and more. And the sphincter tightens. The sphincter tightens as you have more and more urine. So the reflex actually also detects how much urine in the bladder, tells the bladder to relax, and tells the sphincter to tighten. Now when you go to the bathroom and you say, okay, I'm ready to pee, all of a sudden your brain tells your spinal cord and your pons, actually there's a center in the midbrain and the pons that's called the micturition center. Now this micturition center, all it does for a living is it coordinates voiding. Well, it does other things, but for urologists, all it does is coordinate voiding. And what it does, the way it coordinates voiding, it sends simultaneous signals, one to the bladder or one to the sphincter. It tells the bladder to squeeze, tells the sphincter to relax. To tell the bladder to squeeze, to the sphincter to relax, tell the prostate to relax. And sometimes, if someone has a spinal cord injury and they disconnect the nucleus, the onus nucleus, which sits in the spinal cord from the pons, then the bladder is contracting, but the sphincter is not relaxing, and this is dysfunctional voiding. Bladder is contracting, the sphincter is still tight. So now you're basically stepping on the gas and stepping on the brake at the same time, and it can hurt, and it can be extremely uncomfortable, and more importantly, what it does, it generates extremely high pressures in the bladder. And this is very important, because if there's a lot of pressure in the bladder from the bladder contracting and the sphincter not relaxing because it's tight, the pressure can back up into the kidneys. Think about it. The kidneys are there. They're pushing the urine down into the bladder. Now the bladder, if the bladder is contracting to get the urine out, but the urine is not contracting because the door is closed, the pressure goes back up into the kidneys. And high pressure in the kidneys is very dangerous because it's detrimental to the kidney, and eventually someone can have kidney damage enough to basically ruin their kidneys. And someone ruins their kidneys, that's really not good, because they have to go on dialysis and the whole other number of problems. So suffice it to say that coordinated voiding is contracting the bladder, relaxing the sphincter, and discoordinated voiding, what's called dysynergia in voiding, that happens when you have the bladder contracting and the sphincter is tightening. And when that happens, we need to figure out exactly why. The way we diagnose it is with the urodynamics testing, where we measure the pressure in the bladder and measure the outflow of the urine as it comes out and see what happens, as well as the activity in the urethra, as well as in the sphincter, and it could be caused by a number of things that we can diagnose and treat. So that's about the magnificent mechanism of voiding and how it can go wrong.